Hi, I'm Holly, and this is a presentation on natural therapies for chronic diseases. We will be discussing mental illness with a focus in schizophrenia. Mental illness is a wide range of disorders that can affect a person's mood, thinking, and behavior. Examples of mental illness can include depression, anxiety disorders, schizophrenia, eating disorders, and addictive behaviors. As of 2018, 19.1% of U.S. adults experience some form of mental illness. It has also been reported that the U.S. has paid over $201 billion for the cost of mental illness disorders or conditions. Schizophrenia is a mental disorder in which a person interprets reality abnormally. Symptoms can include hallucinations, delusions, extremely disordered thinking, behavior that impairs daily functioning. There are no known causes for schizophrenia. However, research say that it's a combination of genetics, brain chemistry, and environmental factors. Treatment for schizophrenia heavily relies on medications like antipsychotics, which can cause extreme side effects. Though schizophrenia occurs worldwide, the number of cases at any one time only approach roughly 1% in all of mental illness cases. The age of onset for schizophrenia is between 18 and 25 for men and 25 to 35 for women. The disease can affect men more than women, and the prognosis for men tends to be much worse than that of women. The cost of having a disease like schizophrenia is roughly $155 billion a year, which is close to about $45,000 a person. Schizophrenia is a heterogeneous group of disorders with unknown etiology. Cognitive deficits in individuals with schizophrenia are considered the core symptoms of this disorder. Antipsychotics enhance positive symptoms, but only modestly to improve cognitive symptoms. Environmental as well as genetic risk factors can be shown in the early neurodevelopmental pathogenesis. The lack of treatment that improves cognitive abilities currently represents a major obstacle in developing more effective therapeutic strategies for this type of debilitating disorder. Schizophrenia disorders share several psychophysiological abnormalities found in chronic schizophrenia, such as a failure of P50 suppression or the capacity to gate or appropriately modulate or inhibit sensory input, deficits in pre-pulse inhibition, which is the capacity to inhibit the startle response within a weak pre-stimulus, impairment of smooth pursuit eye movements, as well as errors in antipsychotic tasks. Omega-3 polyunsaturated fatty acids are a type of fatty acid that cannot be synthesized by humans. Therefore, it's termed an essential fatty acid and must be obtained through dietary and/or supplementation. You can find these omega-3 fatty acids in food sources such as fish. The omega-3 fatty acids which have been investigated the most in correlation of mental illness are EPA and DHA. DHA is a major omega-3 polyunsaturated fatty acid and the phospholipid of neural cell membranes. There is good evidence that changing the DHA content of the neuronal cell membranes can alter the densities of dopamine, serotonin, and muscarinic receptors in the brain. EPA is not present in neuronal cell membranes and can affect neural function due to its important precursor of eicosanoids and modulator of cytokines that have neurotransmitter and neuromodulatory effects. There is a vast body of science associated with omega-3s, supports consumption of overall wellness, including heart, brain, and eye health. There is also a recommendation for consuming roughly 500 milligrams of EPA and DHA per day for general health and higher qualities for specific life stages or other health conditions. It has been shown repeatedly that schizophrenic patients have reduced cell membrane levels of polyunsaturated fatty acids, particularly that of DHA as well as AA. In this study, tests were conducted on red blood cells, RBC, from those with schizophrenia. RBC membrane levels of polyunsaturated fatty acids are regarded as a reflection of brain levels and has been shown that the two correlate significantly in adult humans. showing the reduction of RBC levels and DHA are not necessary or inevitable association with schizophrenia, but could modify the presentation and the course of illness. In this study, the study sample was a subset of a large group in which 1,120 patients, 1,057 siblings, 665 parents, and 590 controls participated. Non-fasting venous blood samples of FA fatty acids analysis were collected at participating mental health. The results of the study concluded that the fatty acids of the RBC of patients was slightly lower than that of their siblings and controls. And a double-blind, placebo-controlled study was conducted on first episode patients with schizophrenia. EPA-enriched oil or corn oil placebo was given to unmedicated patients for 3 months. Out of 14 patients with the placebo, only 8 required antipsychotic medications after the 3-month period. All patients in the group getting the EPA also required antipsychotic medications, but at a much lower dose. Though the results are encouraging, studies need to be conducted with larger groups to ensure more accuracy among patients. In a double-blind, placebo-controlled trial of adjunctive EPA in 87 patients with schizophrenia, the study was to determine the augmentation of neuroplexics with 3 grams a day of EPA if it improves symptoms and cognition in patients with schizophrenia or schizophrenia disorder. Over a 16-week period, 87 patients were randomly assigned to receive either 3 grams of EPA or placebo. Assessments were performed at the baseline as well as weeks 1, 2, 4, 8, 12, and 16. This involved a cognitive battery test which was administered at the baseline as well as week 16. Over the course of the 16-week period, no differences were found in either group, either positive or negative symptoms, mood, cognition, or global impression. Ginkgo extract is collected from dried green leaves of the ginkgo plant and is available as liquid extracts, capsules, and tablets. Researchers believe that ginkgo can improve cognitive function because it promotes good blood circulation in the brain and protects the brain and other parts of neuronal damage. Ginkgo has antioxidant properties and has also been found to improve brain circulation at the microvascular level. Negative symptoms in schizophrenia seem to have an underlying cognitive defect, and it is logical to assume that ginkgo as an antioxidant may positively contribute to the treatment of this disorder. This double-blind, placebo-controlled study was aimed to explore the association of responsiveness of add-on therapies with the age of onset over the course of 8 weeks. All trials included the analysis used standardized ginkgo preparation EGB as an add-on therapy and were compared against a placebo except in one study. Symptoms and cognitive tests were noted at baseline as well as weeks 1, 2, 4, 6, and 8. The study showed that EGB is effective only when added in conjunction with a patient's current antipsychotic medication. Again, in this study, the groups were too small and the studies were not done for a long enough amount of time to achieve any further positive results. In this double-blind, placebo-controlled randomized clinical trial, researchers tried yielding primary results on the effects of administration of GB extracts in neuropsychiatric patients. The study included 10 participants per group with a treatment period of at least 6 weeks. Ginkgo was used in adjunctive therapy to different antipsychotic medications such as clozapine. The trials used the SANS and SAPS as outcome measures for the clinical trial improvement. Despite the heterogeneity of the clinical trials, available evidence is enough to support the use of GB as an adjunctive therapy in schizophrenic patients. In this study, there was slight improvements to cognitive thinking at the end of the study, though again, the study did not last very long and the group participant was extremely low. Previous studies show that there are some typical pharmacological effects of flavonoids and terpene lactanes, such as antioxidation and free radicals, when taking schizophrenic medications. Ginkgo is believed to contribute to the prevention and treatment of brain disorders, such as dementia, memory loss, stress, and anxiety. The possible mechanism being a combination of the effect of increasing cerebral blood flow, improving energy metabolism, and clearing free radicals. In this randomized controlled trial for adults with schizophrenia, the study was aimed to lower the dosage frequency of harsh antipsychotic medications in a clinical setting by taking the ginkgo supplementation. This study was measured in global state, mental state, as well as adverse effects. However, this study is still currently ongoing with no results as of yet. Since schizophrenia patients have several deficiencies that result from being troubled eaters, side effects from harsh medications, as well as the schizophrenic symptoms alone, having a nutrient-based therapy could be extremely beneficial. After the previous studies, one nutrient alone or with current medication does very little, if anything, in part of symptoms of schizophrenic patients. I feel with larger group studies, as well as maybe a combination of several nutrients, this mental illness can start to become more manageable. Other alternative therapies for nutrient-based for schizophrenic treatment are B vitamin treatments for schizophrenia. B vitamins help to convert food into energy, create new blood cells, and maintain healthy skin cells, brain cells, and other body tissues. These studies are currently being done with B vitamins in conjunction with current antipsychotic medications to treat symptoms alone of schizophrenia. The research indicates that taking in high doses of B vitamins like B6, B8, and B12, they can significantly reduce schizophrenia symptoms as a whole. Additionally, a combination dose of several vitamins was shown to have the same beneficial effect. This vitamin also includes vitamin E.